Hello there, I'm Dr. Ram Biletti, Chief Physician Executive at Community Health Network. I want to give you a brief update on what's going with coronavirus here in the state of Indiana, even more locally in central Indiana. As everyone knows, there's been a huge spike in the number of cases that have been occurring over the past several weeks. Some people are stating that just might be due to increased testing. That could be part of it, but that doesn't explain the whole thing. The positivity rate in the state of Indiana is going up. But even more worrisome for me as a frontline healthcare provider is that the number of hospitalizations is going up quite a bit. We're at the level of the state of Indiana. We have more COVID-19 patients hospitalized with the diagnosis of COVID-19 today than we did at any time in our history and in any days during our first surge. So it's not just more people being tested positive, but more being hospitalized. And with that, we're seeing more people dying from it. And so it's just more and more important that we be careful with how we take care of ourselves. What we've noticed is that this is actually happening due to more, not major hotspots like bars or restaurants, but from smaller family gatherings. Why is that? Well, today, if we look at the number of people that are testing positive, there's likely more than 100,000 Hoosiers that have the virus and that they don't know that they have it. That means that 1 in 100 people are actively shedding the virus and they don't know that. To put that in perspective, at the start of this entire pandemic, 1 in a million Hoosiers had the virus. Several months ago, 1 in 100,000 had the virus and were shedding it. A few weeks ago, 1 in 10,000, and 1 in 1,000. But today, as we speak, 1 in 100 of your fellow Hoosiers has the virus. It could be you, it could be one of your family members, and we're spreading it without realizing it. What that means is very, very important that we do wear a mask all the time. Very critical we do that. That's the most important way to stop the spread of this. When we have gatherings at home, it's important that we don't get lax with it, and we be careful who we're around, make sure we quarantine ourselves, and most importantly, make sure we don't go around the most vulnerable patients or most vulnerable Hoosiers. Those that are above 65 or 70 that have significant comorbidities or other health issues, we've got to be exceeding cautious. As Thanksgiving comes around, I can't stress enough that there's a lot of us that may be having the virus and shedding we don't know. The safest way to do that is if you want to meet with family members is to quarantine yourself for 14 days so you know you don't have it before you meet with other family members. While this is a difficult message, we would have to strongly encourage not traveling and keep the limit size for Thanksgiving at home. If you are going to have relatives at home or family gatherings, ideally you do it outside. At the very least, you keep several windows open to get as much air ventilation as possible. Keep your masks on even inside your home and only take them off when you're having dinner. Even when you're eating, I prefer you do that outside. But keep your masks on because you cannot assume a fellow family member is not potentially shedding the virus. Just by the amount of people that have it, it could be any one of us. We will get through this, but we do need to remember what works and what doesn't work, and that we can't lose sight of what we need to do to get through this winter season. The last thing we want to see is our family members succumbing to the virus. We've had several thousand, more than 3,000 Hoosiers that have passed away. We've signed hundreds of death certificates here at Community Health Network. I certainly hope that doesn't occur during the Thanksgiving and Christmas seasons. So let's do our best to not socially gather. If we do, make sure we wear a mask, even if it's inside our homes. Try to keep the doors and windows open and do as much outside as possible. And with that, we'll get through this together. Thank you.